Good morning, good afternoon, good evening. I am Dr. Quigieng, and today we will be talking about kidney stones. Kidney stones. There is a kind of pain that until you experience, you may not fully understand the meaning of the sentence drink at least 1.5 liter of water daily. Drink at least 1.5 liter of water daily. Usman. Usman was one of my patients. Back then he was 24 years old and he came to the consultation in extreme pains. He was feeling excruciating pains at the level of his upper back. The pain was moving from his upper back towards his private. It was crampy in nature, lasting between 30 minutes to 2 minutes, but very severe. And the pain was so intense that he was restless. He could not stand still or stay on a particular position. He was dancing around, rolling, looking for a position that could relieve the pain, but there was none. He was feeling so much pain. So when he gave me the description of his pain with the high index of suspicion, I thought of kidney stones and I gave him some injectable pain medication which relieved his pain. When the pain was relieved, he admitted to be a cattle rearer, these people that move around from one town to another with sheep or cows. And he moves long distances on foot under the sun and he does not know how much water he can drink in a day. He said maybe one sachet or two sachets because he's very busy looking after his cattle. So following our exchange, he did some laboratory and some imaging tests, and my suspicion was right. He had a kidney stone in the left ureter. The stone was not very big. Eventually, with time and proper hydration, it will pass out to the outside through urination. So our topic of discussion of today is kidney stones. So we are going to talk about what is a kidney stone, how does it present, what to do, and most importantly, how to prevent it. A kidney stone, as you see here, kidney and stone. Stone here refers to precipitates because our body has about 5 liters of blood, 5 to 6, which are filtrated through the kidney in a kind of a cycle continuously. So depending on the level of water in your system, your blood may be very liquid or viscous. So if the blood is viscous during the process of filtration, you are going to have a urine with very little amount of water, and when the amount of water is small, it gives room for the solutes or the crystals in the urine to precipitate and form stones. And depending on where these stones precipitate, we give it a particular name. Kidney stone here is kind of a generic term, but we usually say urinary stones because they may precipitate at the level of the kidney, the ureter, or the bladder. So we may talk about kidney stones, ureteric stones, or bladder stones, depending on where the stones form. How does it present? The first thing is pain, usually unilateral pain or flank pain. That is intermittent, crampy in nature, makes you restless, comes in episode, move from your back to your private. Depending on the size of the stone and the location, you may also have bloody urine, you may have signs of urinary infection, painful urination, fever, and the many other urinary symptoms. But the key symptom here is pain that fits the above description. So, if you have this type of pain, it is very important to find out what are your risk factors, and there are multiple. You have some particular disease like gout or leukemia, if you're undergoing some treatment that predispose you to have stones. Equally, dehydration. If you don't hydrate yourself properly, you are at risk of having stones. What to do if you experience this type of pain? Very simple. Rush and see your doctor who is going to relieve your pain, is going to do a little workup to find out exactly where the stone is, the size, and decide on the type of treatment. Treatment might be just with some medicines or with surgery. It depends on many parameters that are patient specific. So we have talked about what the kidney stone is, we've talked about how it presents, we've talked about what to do, but most importantly, how to prevent stone. Remember, I don't wish you to experience the pain of kidney stone before you understand that it is important for you to drink at least 1.5 liter of water. This is the key preventive step. Proper hydration. 1.5 to 2 liters of water daily to drink throughout the day. Not that you wake up at 6 o'clock and you swallow a bottle of water. No. Little sips every hour, every 1 hour, 30 minutes throughout the day. But by the time you go to bed in the evening, you should make sure that your bottle that you had in the morning is empty. You can even drink more, it is better, but make sure that it is continuous drinking throughout the day. Not a bottle in the morning, not 10 liters on Monday so that you cover for the whole week, but continuous drinking throughout the day. Kidney stone is a very painful condition. Do not wait to experience it before you take the preventive steps. If you experience it, you may be lucky and have a simple kidney stones. You may be unlucky, you have a complex one that may give you a kidney failure, or that may require surgery for your treatment. Thank you very much for your kind attention. It was kidney stones. See you another time for a medical education. Nice day.